Welcome to End Pain Stigma. I'm your host, Pamela Curtis, Vice President here at End Pain Stigma. We are a 501c4 nonprofit made up of chronic pain patients and their healthcare providers working to end the opioid hysteria and its terrible effects on the treatment of pain. Chronic pain patients often feel like their doctors are to blame for the poor pain treatment they receive. After all, it's the doctors we see. It's the doctors who are seemingly uncooperative. It's the doctors who are the gatekeepers. And it's the doctors who say no. But patients rarely know the pressures that doctors are under or the risks that they take providing care. All it takes is an accusation, not even proof, that one patient has misused a medication and the healthcare provider loses everything. Not just their license to practice. They lose their house, they lose their car, all their savings in what's known as asset forfeiture. And after that, they then have to defend themselves against a federal accusation or spend up to decades to prison. It's no wonder that they often are unwilling to treat. On the other side, the public has been told that it's doctors who are to blame for the opioid overdose crisis. But that's simply not the truth. Opioid prescribing is at an 18-year low, but opioid overdose deaths have risen dramatically in that time. The reason for this is twofold. One, illegal fentanyl is largely to blame, imported from China via Mexico. Fentanyl wasn't even illegal in China until pressure from the Trump administration forced China to crack down on fentanyl production plants. And fentanyl is far easier to smuggle into the country than heroin. Fentanyl is measured in micrograms, whereas heroin is measured in grams. Fentanyl is also 25 to 50 times stronger than heroin. Thus, it is possible to smuggle in 25 to 50,000 doses of fentanyl in place of one dose of heroin. This makes it an ideal product for drug cartels. Two, illegal drugs are, well, illegal. Drug addicts inject in secret, so they overdose in secret and die in secret. If drug addicts were able to inject under a watchful eye, any overdose could be stopped by a readily available rescue medication such as Narcan. However, since drug addicts can go to prison for using illicit opioids, they make sure to use wherever they won't be discovered. That is, until the stench of the corpse is overwhelming. We here at End Pain Stigma want to end this terrible cycle. The war on drugs has been going on for nearly 50 years. It's an abysmal failure, and innocent patients and doctors are getting caught and killed in the legal and regulatory crossfire. Chronic pain patients have a disease just like cancer, just like diabetes, but only pain patients are told to suffer the symptoms without treatment. Only pain patients are told to tough it out. And if a patient of a cardiologist doesn't use their prescription properly, their doctor doesn't lose everything and go to prison. But it's what we're doing to pain doctors. It's the only medical profession where you can do everything right, everything legal, and still go to prison. It's no wonder there are a shortage of pain doctors. It's no wonder they're unable to treat. Only 4 out of every 1,000 people are addicted to opiates, but 300 out of every 1,000 has a chronic pain problem, and half of them have a severe, persistent pain problem. But there's no pain enforcement agency. There aren't trillions of dollars spent on chronic pain. We aren't spending billions per day to address the suffering involved in persistent pain. We do that in the drug war. Please help us end the stigma on pain. Thank you for listening. I'm Pam Curtis with End Pain Stigma.